Good day, everyone, and welcome to the 8th session of UPM SILab's IOL 101 Webinar Series 2025. I'm JR Pal, and I will be your host for today's webinar session. We at UP Manila Standards and Interoperability Lab, or UPM SILab, envision achieving universal health coverage through digital health capacity building and appropriate use of digital health technology. That's why we are bringing you fresh topics, diving deep into the latest trends and challenges of digital health and interoperability. So I invite you all to join our weekly IOL 101 webinar series 2025 every Wednesday. Last week, we launched IOL 201, which is Community Connect, with Mr. Peikan Last of Wireless Access for Health Initiative, or WA, as our first speaker. He emphasized the vital role of local governments in building integrated health systems and stressed the importance of inclusivity and cultural dynamics in achieving interoperability. Key challenges like fragmented systems, paper-based processes, workforce issues, and infrastructure limitations were tackled, along with actionable solutions to create equitable and connected health systems. This morning, I'm honored to have you all join us as we explore the fascinating topic of IOL 101, artificial intelligence, or AI, in precision healthcare and medicine. As we all know, artificial intelligence is transforming industries, and healthcare is no exception. The potential of AI to deliver highly personalized care, optimize treatments, and revolutionize patient outcomes is truly groundbreaking. Guiding us through this fascinating world is none other than Professor Hsu, an expert in the field and pioneer in the integration of AI and medical science. With years of experience and research under his belt, Professor Hsu will help us understand how this transformative technology is shaping the future of healthcare. Again, thank you for joining us, and we look forward to an engaging and informative session with all of you. Okay, but before we proceed with the session proper, quick rundown of the house rules. Okay, this session is being recorded, and by proceeding with the meeting, you are consenting to be recorded. Kindly stay muted throughout the lecture, and a virtual background has been provided to your emails, so turning on your camera is much appreciated. We encourage everyone to please change your name for proper identification, and please add your affiliation beside your name for proper recognition. We want this session to be engaging and interactive, so there will be a Q&A portion after the lecture. So feel free to actively participate and don't be shy in asking your question. We have three options. You can use the raise hand function and unmute your mic. You can ask your question directly to Prof. Shu. You can type in your question in the chat box. Or if you want to ask anonymously, you may use the Q&A button. And after the webinar, please answer the evaluation form to receive your electronic certificate of participation. And lastly, please do not leave the session after the Q&A, as we will be having our photo day. Okay, and to move on, I would like to invite to join us virtually UPM SILab Project Manager Chien-Yeh Hsu to briefly introduce the UPM SILab's community of practice. Over to you, Chien-Yeh.
Okay, good morning, everyone. So we would like to invite all of you, especially new friends and colleagues, to join UPMC Lab's community of practice. Our community of practice is a group of experts and practitioners, all passionate about advancing standards and interoperability in healthcare. We share valuable insights, tackle challenges, and work together towards creating and sustaining healthcare solutions. Please join our community. Everyone is welcome. I will be pasting the link shortly so you can sign up to receive our newsletter and join our WhatsApp group. Or you can scan the QR code on screen. And for the next slide, I'll hand you back over to JR.
Thank you, Chien-Yeh, for that. And so, for today's agenda, may I introduce our speaker for this session of IOL 101. Our esteemed speaker is a distinguished leader in the field of medical informatics, currently serving as a professor and the chairman of the Department of Information Management at the National Taipei University of Nursing and Health Sciences, or NTUNHS. His research interests spans a remarkable range, including electronic medical records, hospital information systems, cloud computing, standards, blockchain architecture in clinical informatics, biomedical databases, and biosignal processing. He is the president of the Asia Pacific Association for Medical Informatics, or APAMI. He has held prestigious roles such as the president of the Taiwan Association for Medical Informatics and director of Taiwan Standards and Interoperability Lab, Smart Healthcare Center of Excellence. A fellow of the International Academy of Health Sciences Informatics, his work has significantly advanced health IT standards and practices, earning him a global reputation as a pioneer. With over 2 decades of groundbreaking contribution, he has championed projects like HIMSS, MRAM in Taiwan, introduced numerous best practices in health, IT, and collaborated across the Asia Pacific region to improve healthcare delivery. And now, without further ado, to present the artificial intelligence in precision healthcare and medicine, let us virtually welcome Professor Chien-Yeh Hsu. Over to you, Professor Hsu.
Okay. All right. Yeah, is the voice okay?
Yes, Prof.
Okay. Thank you. So, welcome everyone. Good morning. Regarding TAMI, Asia Pacific Medical Information Association, I would like to congratulate Dr. Alvin, who is become the new chair of APAMI, and we will have an official turnover ceremony in August this year. Okay, let me share my screen. Oh no, sorry. This one. Okay. Okay, is this okay to see my presentation slide?
Yes, Prof. We can see
Okay,
it.
good. So today we're going to talk about AI, okay, artificial intelligence in medicine and healthcare. Um, I would like to say more about the big data because the big data is the fundamental of artificial intelligence because all the AI algorithm using data to create so-called models. And we will use the model to do a lot of predictions, diagnosis, and treatment for the decision support. So currently, I'm the fellow of the International Academy Health Science Informatics, and also I'm also work in several association, medical informatics association in Taiwan. Okay, so let's see this slide. Okay, precision medicine and the big health data, which is the two way, but support to each other. We can see here we lots of research method and research models are changing from hypothesis first driven research to data driven um, research. So that means we use more data to create hypotheses and use this hypothesis based on hypothesis to analyze more and more data to get the conclusion. Instead of at the beginning, we set up hypothesis. So that means we from the data generation, data analytics, visualization, and the data translation. Finally, we would like to um, um, get the result and applied apply the result in so-called personalized medicine. So precision medicine is really based on big health data. So I would like to talk about some of the fundamental architecture we built in Taiwan. That means many years ago, when we start to run the national health insurance, we start to collect data and basically so-called electronic medical record architectures. So that is the virtual private network we used for the NHI. So you can see we create several cloud. This one on the bottom is the medical services administration's cloud. And the yellow one is the government administration cloud. And the blue one is the IDC, Internet Data Center, and headquarters for the National Health Insurance. So you can see those green lines means we the data are transferred from the hospital and the pharmacy to and from to the internet data center of health insurance, and also um, almost in real time. And the government department, for example, the CDC, can access those data through a service center. Um, use the data from the hospital all over Taiwan island. So that means this virtual private network has been built for almost 30 years. So that means those data are stored with the you see in the National Health Insurance Data Bank, and that data is already used for research and study for many years. So we build this kind of network first for the data purpose. So there are several slides. I will go very quickly. The national health insurance expenditure in GDP in Taiwan is about 7%, and the life expectancy is about 80 years in Taiwan. Okay, this is the major feature of NHI in Taiwan. That is a single payer and a universal coverage, comprehensive uniform benefit, and easy access. Almost no gatekeeper. So affordable cost and also high public satisfaction. That is the IT adoption in Taiwan. So just like I said before, the national health insurance launched, we start build a network starting from 1988, and that is the phase one. And 1998, another phase two. We call this Health Information Network 2.0. And today we build a lot of cloud since 2013. There are many so-called health cloud in Taiwan. All right. So the major trend of medical informatics, everything is based on data. So so we need to know that data is the fundamental. So we have several steps. First of all, we call this a visualization or digitization. We digitize everything. Okay, we use a computer system in all the hospitals, pharmacies, and clinics. And the second step is the so-called aggregation. We we integrate the data under the system level. So all the system and the data can be integrated And that means the data can be exchanged between systems inside the hospital, for example. And the third step is the standardization and exchange. That okay, everybody is talking about the healthcare and the medical data standardization. For example, using HL7 file, using LOIC coding, the IDC code, the SNOMED code. So there are many so-called medical data standard we need to follow. So in this stage, we try to make sure, try to create a platform for the data to be exchanged between hospital and they can be used all over on different purpose. So but anyway, that is a very difficult task. We spent almost 20 years in Taiwan, but we are still working on that. So that means the data standardization are very difficult to reach. But anyway, because we have the national health insurance, in Taiwan, we do have our own uh, data format and the data standard, which is not exactly follow the international format. But anyway, it is kind of local data standard. We every hospital are using, but we are transferring those data standard to the goal is to confirm with the international standard format. For example, the HL7 file today. So finally, we try to do the intelligence. That means we use this data to build an analytic model, prediction model for all kinds of different purpose. So it's from the eHealth Taiwan, mHealth, M Taiwan, and the U Taiwan. So and finally the intelligent Taiwan. That means we use the data to create a lot of applications today. Okay, I will skip those. Uh, well, this is just I would like to show. This is the maybe in different country we also have so-called national health insurance card for the health professionals and also um, for citizens. Okay, so the Taiwan National Health Strategy plans to establish a national electronic medical health record and medical imaging exchange center. Secondly, each citizen has his own electronic medical record and can be used the record and download record today. And also building interoperable EHR is our top priority. So EHR must be patient-centric, patient-initiated, and patient-owned. We almost reached this goal today. Um, well, because the effort provided by the National Health Insurance. This is kind of cloud um, computing in healthcare. So just that is just example. So we have this prevention and healthcare service cloud that is used by many hospital and many preventive institution and the medical service cloud for hospital and the rehabilitation follow-up services for long-term care and also the data and health data and analysis feedback cloud. So that is the center in the Ministry of Health to analyze the data and give feedback to different organizations. So this is just a very old architecture for we to do the medical electronic medical exchange. You can see from the internet we have a careful designed administration and for different hospital in this green oval we can exchange the patient's medical record um, and use the record access the record from for a single patient from different hospitals, and also different architecture for patient to use their medical record, in real time or in the not real time. So the Ministry of Health also created so-called EEC, the Electronic Medical Record Exchange Center, so the doctors can access the patient's medical record from different hospitals. So that is the another that is for image exchange. Very similar architectures. So the national health insurance, from this slide, you can see the NHIA, which is a single payer systems. The population pay the premium to the NHIA, and we receive the IC card, and for the hospital, we pay the co-payment, and the hospital provide the healthcare services to the patient, and also the hospital send the claims data back to the NHIA, and NHIA reimburse the hospitals. So because so that means the NHIA collect all the medical data here. So the NHIA create a so-called National Health Insurance Research Database here. So the researcher and the other people, if you are interested in analyze the data, you can use this so-called NHIRDB to do our research. So that is the Taiwan's universal health insurance database covered for all populations. And also you can see, that is the paper published. Well, I didn't show it here today, but there are many papers published using HIRDB. So also in Taiwan, we create a Taiwan Human Biobank, also release genotype related information through this website. So we can see from the start, starting from the ancient people, we call this traditional medicine 1.0, and till today we call it basically the medicine 2.0, the modern medicine, which is based on chemistry, and we a lot of procedure and drugs are created. Well, currently we are entering so-called molecular medicine, medicine 3.0, starting from the Watson and Crick's genome, personalized medicine, and something like a target therapy. And finally, I think we also try to use AI on the data, big data, for the smart medicine, medicine 4.0, and which is like go back to very traditional medicine, because Chinese medicine, we call it system medicine. We use lots of data and the experience for the future. So the big data and AI will be the very fundamental for the future smart medicine 4.0. So what is the development logic for smart healthcare and the medical big data for precision healthcare and the personal healthcare? So I would like to show you this, starting from the left, the big data. Okay, usually we use a people, okay, person, people, human being. We use data to create knowledges, and we use our knowledge on our practical exercise, and we use this on the business and the consumer. Well, different application, different all this way. Okay, from we use data, create knowledges, and we create more and more data from our business and the consumer. Okay, you can see we collect lots more data from here, from the applications. However, when the data are too big and the human being cannot analyze the data. We don't have the enough ability. The human brain cannot do that efficiently. So we need to use artificial intelligence to help us analyze the data and create more knowledge for us to use. So today, the AI, because the data are accumulated so fast, so the human brain can no longer analyze the data and create knowledge efficiently. So that is what we need to use AI to help us create knowledges. But anyway, I need to say that the knowledge created by AI is sometimes totally different from the knowledge created by human brain. So just like this, like ChatGPT, the artificial intelligence, such as the deep learning process, the machine created knowledge, and most of the time, we a human brain cannot really understand what kind of knowledge they are creating. So, so the digital transformation of healthcare, the essential is the creation, storage, transmission, accessing, and the utilizing data. The 4P medicine is a good approach. That means personalization, participation of and the prediction and the prevention models are a very good approach when we use the data for the digital transformation. Um, so precision medicine needs a platform. That platform operate data and analyze data and create knowledge and use the knowledge into our applications. So this is some of the example we created in Taiwan, the data architecture by subject with active analysis and assessment, which is a fundamental architecture we built for the Ministry of Health. Today, they collect lots of data, different health data, and also create on the right-hand side, you can see the public health, different purpose for data to use. Use for public health, use the data for epidemiology, use the data for healthcare management, and many other purposes. So the user can access the data for of course, the identification of data for their research and other studies. This is what I proposed many years ago, and still are working on this kind of data. We call it the AI disease prediction model. And this is a so-called event-driven active learning disease prediction model. You can see from the left-hand side, we put a lot of information and data. And the right-hand side is the prediction statistic. We try to, if you put enough data here, then we can, and also your personalized data, we can predict based on your status, your disease probability, and here. And also if you have intervention and treatment, for example, so the people will do something to improve the health status, then the prediction model will give you maybe some kind of better statistic for your disease predictions. And also we can see here is the event vectors. That means if you please note that there's a timeline here. So if you do something to improve your health status, for example, you stop smoking, you do like a dietary process, then that will improve. You exercise more, okay, that also improve your health status. Then also at the right hand side, you can see the better predictions. So this is a complicated architectures. So for example, at the we put a lot of data here. For example, population medical data, laboratory data, environmental data and lots of open data, maybe. So we can create a so-called big data-driven multiple probability matrix for general purpose disease predictions, which may contains many, more than 30,000 different disease diagnoses here. So use this population-based, we can create something like a metabolic syndrome prediction model, or like an AMI prediction model, okay? From time, this is timeline, and that is the probability, okay? And of course, we would like to use this population-based onto so-called personalized these predictions. However, if we want to use personalized disease prediction, we need to input individual health data. For example, here. So when we put our individual health status, this population-based general purpose disease prediction data prediction model will become a so-called personalized disease prediction model. So based on that, those the single patient's prediction model will be different from the general purpose population base. You can see this is the green picture here. That is so-called personalized metabolic syndrome prediction model, and the result will be different from the general purpose population base. So the disease prediction output value will change due to the personal improvement measure. So after we put our individual health status and we got the prediction result, we may do something more. For example, we improve our, we do more exercise, we improve our dietary pattern, we improve our sleep pattern. So, and then maybe we go to see doctors and get treatment. So that will create more new profile for a single patient. So the intervention will be a circle here to get more and better prediction from, because our interventions here. It is a small circle here. So those data, the new profile of the patient, individual patient, will go back to a part of big data. So the big data will, because of the patient's improvement here, so the big data will go back to the big data driven probability matrix, and a big circle becomes here. Okay, you can see a big circle. So the circle here, and because this it is not used by one person, it can be used by thousand and million patients here. So everyone got a new, the model will generate a new profile for everyone, and it goes back to a big data, become a part of the big data. So the big data driven probability matrix will be improved. So that is the idea, okay? The overall the disease prediction model will something like this, and which is the big project we are working on. So it's not done yet. So some possible application based on these architectures. Oh, sorry. Okay. Possible applications can include personal health application like diagnosis, detections, health risk assessment, reminding, alerting, and decision support. And also can be used for health management, and also can be used for improved personal health status, estimate future medical need and medical cost, cost-effective applications for the hospital, And also for the hospital, we can use this model to fix institution profit profit gaps, and also used for the health insurance applications for the national health insurance. There are some example we created. For example, this is the so-called cardiovascular disease risk assessment using gender, age, diabetic, smoking, SBP, cholesterol. I will just give you some example because we don't have enough time. And this is another example of 10-year prediction model for lung cancer. And some other example, 3 year survival prediction model for lung cancer treatment. Okay, different lung cancer can be used, and it will give you some kind of survival rate, depends on different therapies. And the prediction model for liver cancer after diagnosis of diabetics. And also prediction model for liver cancer after diagnosis of diabetes. So using lots of um, input, you input this, and the system will give you the estimated risk. Okay, so there are more example. We use dietary pattern. Okay, dietary pattern can have we will create prediction model for because we believe that the metabolic syndrome will have effect on the cervical cancers for women, and also a machine learning model for prediction of chronic kidney disease using laboratory data, non-laboratory data, and metabolic index. So there are many examples, and also nutrition related examples. We're also working on so-called AI in precision nutrition, such as these using evidence-based nutrition to establish the recommended framework for nutritional intake for the chronic disease, and also blockchain-based personal health record management and dietary recommendations. Okay, we see that before, and using lifestyle and eating habit to establish a personalized precision health examination item recommendation model. Okay, more examples such as using these personalized data to improve the patient's safety on checking the potential incorporative medicine use for old adult in Taiwan, and also using diagnosis your EMR and the air pollution index to provide warning of air pollution for respiratory disease patients. So there are many these kind of examples. So finally, the value-added health information and the social determinant of health. So you can see when people would like to be health or get disease depends on many reasons and many factors, like organ impairment, pathological change, and neural and the immune response. So there are many factors can affect our health status. So actually, it is a so-called network medicine. We have the social network, disease network, and the metabolic networks. So would like to say that, for example, this is from the paper. That is the so-called degree of obesity depends on your friends. So if your friends are fat, you probably have 45% gut obesity. And so that means we have a very strong, it's not just the disease network and the metabolic network. We also, the social network also has effect on our health status. So that means we would like to the people in the center, and we collect more data for these people, and not just of course from the hospital, from a lot of health management institution and health examination center. We also collect the data like dietary record, exercise record, and biosignal data. We put all data together, and probably we can reach the so-called created disease prediction model for a single patient to use. Just like I said, this is the final goal of my research. Okay, thank you very much. I think I will stop here. If you have any questions, I would like be happy to answer. Okay, thank you.
Thank you so much, Prof. Shu. We enjoyed your informative lecture. This morning, Prof. Shu provided us some background of health-related data analysis, major trends of medical informatics, which are virtualization, integration, standardization, intelligence or smart for knowledge-based healthcare, Taiwan National Health IT Strategy. Prof. Shu gave us also an overview about the development logic smart healthcare, from traditional medicine to modern medicine to molecular medicine as medicine 3.0 to smart medicine, which is AI or medicine 4.0. The 4P of medicine, which is personalization, participation, prediction, and prevention. Overview of data architecture by subject with active analysis and assessment, AI disease prediction model, and possible application of AI. All right. So now I'd like to invite the participants to share their thoughts. We are now opening the floor for question and answer. Again, we have three options. You may use the raise hand function and unmute your mic and ask your questions directly to Prof. Shu. You can type in your message in the chat box or you can use the Q&A button. Okay, anyone? Okay, let me check. Prof. Shu, I want to read this comment or message from Dr. Alvin. Taiwan
Okay.
has a long history of national ID system and card. This made it possible to link their health data to a unique number at any facility in Taiwan, making it possible to gather their data from separate databases using their national ID. And also, Doc Alvin created a little activity, and I would like to ask the audience to participate. If you already have your PhilSys ID, please click thumbs up. Nice, Doc. And we received
Yeah.
17 responses, Prof. Shu, from our audience. 13 received their ID and 4 have not yet received their ID. If
Oh
you want
yeah,
to
I see there's a question about the ID, right? Health ID from the national ID. Okay, so well, yeah, we do have in Taiwan we do have everyone got the national ID uh, after when you after you born so so in 6 months you need 6 weeks I'm not sure you will everyone got a national ID so that ID will the same ID or the same ID will also be used for healthcare. So healthcare ID, I would say that it is the same ID we use for our national health insurance card. So the idea is that that ID will bind with your data and the personal data and also with the clinical data. Um, so the ID is the same. Um, But for different hospital, they also create different ID for different hospital inside different hospitals. So that means in the database, sometimes we can combine the two code ID. So for example, your national ID plus hospital A ID and your national ID plus hospital B, then we will know we can distinguish between what the data comes from different hospitals. So that is the way we do in the national health insurance data bank. Okay.
Thank you for that, Prof. Shu. Prof. Shu, we have another question here. Professor, good morning. Are you working in your healthcare research in AIoT? Can you share some recent trends and direction of AIoT in healthcare? This is from Mr. Rodel Balingit.
Oh, okay. IoT. Yes. Just like I say, we have AIoT is very important. For myself, I just use the data. I am not really create devices, but I would like to say that the okay. Currently, the major research I'm doing is I try to use those data is already there. However, you can see because our health status is a transition, we change every day. So we like to the IoT devices is very important for us to get dynamic data input. Okay, so we use first of all, we use the population data to create a general purpose AI model. And we use the personal data to add on that for our personalized prediction model. Then that is the point because we want to continue tracking the patient's health status. Then we need to collect more and more data from this patient, for example. So maybe probably we will use devices and those devices, for example, maybe wearable devices for their heartbeat and for the diabetic monitoring for the some one of our projects doing the brainwave for the some syndrome for the memory or sleeping syndrome. So then we will collect more and more data back to our prediction model, the original general purpose prediction model. Then the prediction model will be improved based on the dynamic data from the patient. So I would say that is very important part. Myself, I'm not working on that, but I'm working with different people who really do the AIoT, and I try to use their data and putting together back to our general purpose AI prediction model. Okay.
Thank you for that, Prof. Prof, we have another question here. How does a researcher in Taiwan access the population data? Is it accessible to foreign researchers?
Okay. Currently, they create a so-called so-called what information health information science center in Ministry of Health. Okay. Well, it is not very convenient even for the local researcher because we need to apply, we need to register for using the data. Okay, first of all, you need to register and you apply, and they will prepare the data for you, and then the researcher need to go into a fully prepared computer center to use the data. You cannot the data will not be released from the center. So if you want to use the data, you need to go into the data center. So you need to run your data analysis procedures inside the data center. Okay, that is currently procedures. We are not very satisfied for this kind of procedures because their computer, the computer in the data center is not advanced. So sometimes if we really want to run the algorithm like deep learning, like the AI procedures, uh, it is not impossible to run the data, to run the procedure inside the computer center created by the Ministry of Health. So, however, if they are, we're still try to argue with them, try to create a more convenient way to use the data. For the foreign research, if any international people want to reuse the data, they cannot use this data by themselves. They need to collaborate with local people. So, for example, if Dr. Alvin interested on research on using the data, we can collaborate together. We do some kind of project, and then we can use the data through me. So that is the way usually the foreign research do. They collaborate with people from Taiwan, and that is the way we use the data. Okay.
Thank you for that, Prof. Prof, for our last question, this is from Mr. John Lemuel. Does Taiwan have also government EMR or EHR where it integrate the use of analytics?
So that I'm not sure I understand. So that means the government EMR where it integrate the use of okay. Well, okay, because currently you can see we do have the EMR exchange center, but that is only for the clinical services to use. So they don't really collect data. On the other way, the health insurance department, the National Health Insurance Department, they do collect lots of data from the hospital. Okay, all kinds of data. So diagnosis, treatment, imaging report, all kinds of data. However, by law, the data collected by the National Health Insurance is not defined as electronic medical record because the National Health Insurance Department is not the owner of the they don't have the right to own the medical record. So only the hospital can own the medical record, and only so that is the trick here. However, those data collected by the National Health Insurance is almost equal to the so-called is a population-based EMR EHR. So, but it is not defined as EMR by law. So yes, I'm not sure. The answer is yes. If they of course they use this data to do a lot of analytics, but it is not really defined by as I define it as EMR. Okay, but it is almost equal the EMR in Taiwan. I would say that. Okay.
Okay, thank you so much, Prof. And thank you all for all your valuable contribution.
All
Okay,
right.
we will now move on to the awarding of the certificate for our resource speaker. I would like to invite Dr. Alvin Marcelo, UPM SILab's director, to present the certificate of appreciation. Over to you, Doc. Eloy.
Thank you, JR. Thank you, Professor Hsu, for your precious time sharing with us your knowledge and expertise. So I'm happy to award the certificate of appreciation to Professor Chien-Yeh Hsu for his exceptional commitment as a speaker during the UP Manila Standards and Interoperability Lab Webinar Series IOL 2025. Artificial Intelligence in Precision Healthcare and Medicine, given this 19th day of March 2025, held online via Zoom. Thank you very much, Professor Zhu, and please stay. We will have our photo taken by
Okay,
JR.
thank you. We have a photo, right?
And while people are turning on their cameras, we'd like to promote MedInfo 2025. It's going to be hosted by our colleagues from Taiwan. It will be in Taipei. Professor Su is one of the main organizers. Go to medinfo2025.org and you will see all of the instructions on how you can participate in that conference. Thank you also to the team of Professor Shu for making it possible, hosting it in Asia. We only host it every 6, 7 years. So please take advantage that it is near Manila, only a 2 hour flight, and we will already be there.
Yeah,
Thank you,
thank you.
JR.
Thank you. Yeah, please do come. Yeah.
Okay. Are we ready? Okay. In three, two, one, smile. Okay, thank you all for joining us today and making this session a success. Remember, the conversation doesn't have to end here. Once again, I inviting everyone to join our IOL 101 webinar series 2025 scheduled every Wednesday. Flash on your screens the list of topics for March. And for next week, we will have Dr. Anthony Cordero of UP Manila Community Health and Development Program for digital platforms for community health workers, telemedicine, and mobile health. Once again, thank you. This is JR Pingal saying again, captain change one spark at a time. Let's keep pushing the boundaries of digital health together. See you next Wednesday. Bye. Thank you. Thank you, Prof. Shu. Thank you, everyone. Thank you.